Bipolar disorder is developed by a disorder in the brain that causes mood and emotional alterations at frequent and subsequent time periods. Bipolar disorder is characterized by many factors that contribute to the presented illness. Those individuals who suffer from bipolar disorder, also called a manic depressive illness, experience imbalance and fast changing levels in energy, emotional interest, and ability to carry out activities of their daily life. Genetics plays a role in the development of bipolar disorder as it tends to run in the family history. Individuals who suffer from bipolar disorder show to have different brains, especially the prefrontal cortex, which is in charge of decision making. Individuals with bipolar disorder experience emotional mood changes, each emotion completely opposite of the previous mood. These changes are called mood episodes, and they occur over and over again frequently as time goes by. Other signs of bipolar disorder include changes in levels in energy, physically or mentally. People with the disorder lose interest in activities that they once enjoyed, like sports, hobbies, friends, sex, and begin to experience hopelessness during negative mood episodes. Sleep patterns are altered usually when positive mood episodes occur, such as taking up new tasks. Other behavioral changes include an increase in irritability, restlessness, impulsive high-risk behaviors, and thoughts of suicide. Doctors can diagnose bipolar disorder using guidelines from the Diagnostic and Statistical Manual of Mental Disorders. There are 4 stages or types of bipolar disorder, and the symptoms and signs must be very different from the former moods and behaviors, as very evident and occurring at least a year, and mood episodes last from 2 weeks up to 2 years. Because blood tests or brain scans do not show any particular evidence of bipolar disorder, physicians must diagnose the patient by a physician examination, interview, and lab test. These diagnostic procedures help the physician rule out the other factors that can be associated with the mood alterations, which do not correlate with the diagnosis of bipolar disorder. Medical physicians and mental health professionals both have the right to diagnose the disorder and treat the patient. This disorder is not curable, but it is treatable, and the treatment can be effective if continued over a long period. Treatments help the individuals to control their mood swings, but even with treatments, mood episodes will still be present even at a slightest level. Treatments planned include a combination of medication and psychotherapy. Different medications can different effects on each individual, but most medications are given to control the symptoms of the mood episodes, such as mood stabilizers and anticonvulsants. Side effects do occur and can alter the individual's physical being. Other medications are prescribed, such as thyroid medication to help balance thyroid levels. Lastly, other medications such as antidepressants can be prescribed in order to control the negative mood episodes and thoughts of suicide. Psychotherapy in combination with medication is included in the treatment for bipolar disorder. Cognitive behavior therapy, which helps change harmful thought patterns. Family-focused therapy, which involves family coping strategies. Interpersonal and social rhythm therapy, which helps people improve their antisocial or negative behaviors with others. And psychoeducation, which teaches the patient more about bipolar disorder, can all be types of therapies used as treatment. These therapies can be done in private meetings with the mental health professionals or in groups with other individuals also being treated with bipolar disorder. Again, there is no timeline for treatment using psychotherapy. Other treatments used to treat more severe diagnoses of bipolar disorder include electroconvulsive therapy, which is also known as shock therapy, and sleep medications. And the longer any treatment is given, the more effective in controlling or balancing mood changes. But because a disorder is not curable, even the longest treatment period will still have present bipolar disorder symptoms and signs.